Welcome, trainees, to the last trainee e-newsletter of 2021. It's a year that I'm sure you're going to be very happy to be done with, and so are most of us. I want to just say on behalf of the faculty leadership and staff, what a huge amount of admiration we have for the way that you as a group have adapted and responded to the challenges that the last 18 months have brought. It's an enormously difficult and complex thing to try and coordinate an online exam process across 5 different time zones in 10 different cities, but we managed it twice. So we continue to learn and adapt and get better at it. And we thank you for your persistence and your patience and your engagement while all these details are being worked out. We're very proud of the fact that some of the issues other colleges have had with online exams have not, thankfully, reared their heads during our exam process. And a lot of that has been due to the careful behind the scenes work of Kieran Davis and Juliet Whittington and the staff. So if you see them in person over the next couple of years, do thank them personally, because there's been an enormous amount of work gone on to try and make it as seamless and as painless as possible, to keep you guys progressing at the appropriate rate through your training. And you shouldn't feel as though you're the COVID group. Your assessments will be educationally valid, they're rigorous, they're as good as any other set of exams that we've done, and people who get through them deserve to get through them. It's an incredibly demanding role being a pain medicine trainee, largely because of the stage of lives that people are at. Once upon a time, pain medicine trainees were all late to mid-career, all well established, and often doing the training part-time. These days, the trainee profile is much more diverse than it was. Many more diverse specialties, many more people doing it in a range of settings and locations, and we are all the better for that. I encourage you to reach out for mentoring if you're feeling as though you're a bit lost or you're not sure where you're progressing. Faculty fellows are only too happy to talk to you, only too happy to give advice. And we also have a formal mentoring process that's there for you to look at if you wish. But everyone needs mentors, and when I think back about my own mentors getting me through the early years of negotiating my training and trying to get established as a new fellow, I'm just so grateful to the senior fellows who helped me out then. And those of us in the position now of being senior fellows are more than happy to pass that on. So I would really encourage you, don't just do the training to try and get through the exam. Do the training to try and meet some mentors and pick the brains of the phenomenal wealth of experience that we have in our fellowship, and not just our fellows, but our allied health colleagues as well. One of the consistent things I used to see in doing TUAC visits was that there was not enough training of our trainees from the allied health people who have vastly experienced OTs and physios in teaching and training units. And it may be that within a year or two of getting your fellowship, you have to tell a junior OT or a junior physio or a junior psychologist how their job is meant to look. And you can only know that if you've learned it from the best. And we have outstanding allied health people in our clinics. So I'd commend you to seek mentors from among them as well as from among our faculty fellows. But anyway, it's the end of the year, and it's time to rest. It's time to reconnect with family. It's time to enjoy a bit of a break, and we hope to see you all back again for the training year next year. Or for those who have progressed beyond the training program, congratulations, and we look very much forward to having you as part of the fellowship.